All right, joining us again for the latest on the novel coronavirus, this is Peter Pitts. He's the president and co-founder of the Center for Medicine and the Public Interest and former FDA's Associate Commissioner for External Relations. Peter, good to see you on this Friday. New rapid 15-minute test that's in trial, awaiting approval from the FDA. And this with the U.S. having the most positive cases of any country in the world right now. If this gets done, more testing's available. Are we going to see a huge rise in cases? Also, when do you think the test will be available?
Well, here's an update. The good news is it has been approved by the FDA. This is breaking news. And Abbott is getting right on it relative to manufacturing and shipping. I'm not quite sure what their timeline is, but we're talking about millions of testing kits. That's very good news. The not so good news is that I'm pretty sure that's going to lead to an uptick in people who are testing positive. Not a surprise, but the numbers will go up. And that's not necessarily a bad thing. It means that we're really getting a handle on just how widespread the COVID virus is across the United States. And that's going to especially help not just the big epicenters such as New York and out west in San Francisco, et cetera, but also states now that don't really know whether they've got a serious problem, whether they should go on shelter in place. This is going to let them know, I predict, that they actually should go to shelter in place. So these tests that give the doctors the results in 15 or so minutes, I think will lead to broader shutdowns across the country. And that's a good thing because that's how we're going to kill this disease and get on with our lives.
Peter, staying with that news that you're telling us about this test being approved by the FDA, forgive me here, but the FDA doesn't approve things very quickly. There are massive hurdles that a lot of these things have to go through. Talk about that process.
Well, again, these tests, or whether they're drugs or devices or diagnostics, they're not developed in isolation from the FDA. The FDA is involved in all aspects of the scientific development and testing. So clearly the FDA was with Abbott from the very beginning, understood exactly what was happening. When they got the data, they studied it quickly because they knew what they were getting and swiftly turned it around because clearly we're in a national emergency where minutes count.
Doctors and nurses, we think about them. They're on the front lines dealing with the influx of patients. They're coming through the hospitals. We mentioned that because if you are sick with COVID-19, you're going to go to a hospital. Those nurses, those doctors are going to be in front of these people for quite some time. How do we protect them through this, especially in hot spots like New York City?
Well, the importance of a test that doctors can give that will give them a relatively quick positive or negative is it's going to keep people out of hospitals. It's going to keep hordes of people outside of public health buildings. It'll allow people to go to their own physicians and get these tests. And that reduction in density will reduce the threat to our healthcare workers, the doctors and nurses and everybody that's working in hospitals. Because clearly when you have hundreds and thousands and tens of thousands of people descending on hospitals to get tested, it's not the best thing from an epidemiological perspective. So beyond just the speed of the speed and the accuracy of these tests, we're also going to reduce the density of a lot of people who might have the virus being together in one place, putting healthcare workers at risk.
Right. Well, there's what we're hearing are that a lot of people are asymptomatic to this thing, so they may not get tested, but they may be walking around conducting their what we call now everyday life, infecting others. And I think that's where the importance of this mass testing, if you will, comes into play, Peter.
Yeah, that's right. And it also reinforces the fact that even if you're asymptomatic, you need to abide by social distancing and sheltering in place. I am not ill. I don't have any symptoms, and I am social distancing. We're doing this via Skype. I'm sheltering in place. I go out to walk my dog and to go food shopping, and that's about it. Staying inside isn't just for sick people. It's for everybody. That's how the epidemiology of viruses work. You have to take everybody out of harm's way so that the virus has nothing to feed on. And again, that's why you'll see reduction in numbers. That's what happened in Wuhan, and it's what's going to happen here.
Yeah. All right. Well, we appreciate that. You're being very responsible there. Peter Pitts, president and co-founder of the Center for Medicine and the Public Interest, and former FDA's Associate Commissioner for External Relations. Peter, good to see you. Stay safe.